Salam Jatra. My name is actually Ernest Binjek from SR243 Student Part 2A. Today for SPS462, I would like to present three parts, which is splinting, bandaging, and the last one is CPR. Okay, the first one is splinting. What is splinting? Splint is a kind of device to support affected or injured limb or body parts. Splint can be made by anything solid that hard, such as wood, board, and thermoplastic. Splint is effective to reduce risk or further injury and temporary treatment before proper treatment in hospital. And when in hospital, the paramedic will use thermoplastic splint or POP, which is proper support device to support injured limb. Alright, for splinting, why we need to use splint? And splint is very important device to support and avoid further injury or damage to the affected limb. Splint are used to as and external body support and lock for the unnecessary movement. Other than that, splints are used to facilitate healing by resting the injured limb in a proper position and to reduce swelling. The few function of splint is to support and reduce joint pain, uh, to limit movement and facilitate healing of injured limb, to support injured muscle, broken limb, to limit unnecessary movement on affected limb, to encourage function, to straighten the weak muscle, and to avoid deformity of the joint, to rest and reduce muscle pain. Okay, for the time, how long we need to use splint? Once we are injured or sprained, we are advised to put on splint. The use of splint are variety. It is closely related to the type of our injury. For example, if we have a simple broken bone on the hands, uh, you are advised to put on splint at least 2 or 6 weeks. But if you're having a broken leg, you might need to use a splint up to 6 months. And if you have symptom of numbness and pain on your hand, you also might need to use splint during working hours and because to reduce the symptom of splinting. A specialty of about splinting is it was easy to use. You can take it off and put on by yourself for hygiene purpose. But as usual for healing process, we are not allowed to frequently take off the splint. Bandaging. A bandage is a piece of material that used either to support of a medical device such as dressing or splint, or is on to provide support to the body. It also can be used to restrict a part of body, uh, for example, during heavy bleeding or following of poisonous bites. It is important to slow the flow of blood. Tight bandages accomplish this task very well. Bandage are available in a wide range of type, from generic cloth strip to specialized shape bandage designed for a specific limb or part of the body. Although bandage is often be improved as the situation demands, using using cloths, blankets, or other material. Bandaging is the process of covering a wound of or an injured part. What is used for? It is used for bandage are used for following the purpose, which is to prevent contamination of wound by holding resting in position, provide support to the part of that is injured, dislocate joint, to provide rest to the part that is injured, to prevent and control hemorrhage, restrict movement and immobilize a fracture or a dislocation, and to correct deformity. And the last one is to maintain the pressure, especially the elastic bandage applied to the improve of venous return. And the third one is CPR. CPR is stand for cardiopulmonary resuscitation, and it is an emergency procedure that combines chest compression, often with artificial ventilation. It is an effort to manually preserve intact brain function until further measures are taken to restore spontaneous blood circulation and breathing in a person who is in cardiac arrest. This may be happen after the electric shock, heart attack, or drowning. For the what is the main purpose for the CPR? The main purpose for CPR is it is a combination of technique including chest compression designed to pump the heart to get blood circulating and delivers oxygen to the brain until definitive treatment can stimulate the heart to start working again. There are three simples that we can follow because it is easy, which is ABC. A is stand for airways, B is stand for breathing, and C is for compression. Chest compression can help the flow of the blood, uh, flow of the blood to the heart, brain, and to the. Okay, right now I would like to share what I have done for these three type of the video, which is for splinting, bandaging, and CPR. Okay, these three are mainly used in we can see at the sport, which is uh, splinting is when for the broken leg when playing football, bandaging for head or the other part of the body, and CPR is when the players faced with cardiac arrest while playing football or other type of sport.